Hello, Mr. Ashley. How are you doing today?
Doing good.
Good, good. Okay, well, we're going to start with your physical assessment. Let's see. So we would first assess the patient for any rashes or lesions. Can I see your arms? Okay. See if there's any bumps or bruising. Don't see anything. Then we're going to look at the scalp and the head to see if there's any asymmetry, any hematomas, anything like that going on. Look at the symmetry of the face. So let's see. I'm going to go ahead and get my pen light here. Look at the patient's eyes. Look straight ahead for me if you would. Looking to see if the pupils are equal, round, and reactive to light, and if they accommodate. So follow the pen light into your nose. Very good. Go ahead and say "ah" for me. We'll go ahead and knock out some of these cranial nerves while we have the pen light. Go ahead and stick out your tongue for me and say "ah." Good. We're looking to make sure that that tongue is midline. Excellent. And I'm actually going to move this very quickly over here. Okay. All right, so next we will look at the ears. We're going to be looking at the outside of the ear to make sure that there's no infection noticeable on the outside, to see if there's any irregularities there. We're going to go ahead and look in the ear. Let me turn this on. Okay. Come on this side. Looking at the eardrum, we want to make sure that the eardrum is nice and grayish with a little bit of shine. We don't want to see any redness or bulging of the eardrum. We're also going to go ahead and look up the nose, looking at the nasal passageways, looking at the mucosa to make sure there's no irregularities there as well. All right, and then we'll go ahead and do the eyes. Okay. All right, we're going to stand at a 30-degree angle. If you'll just look straight ahead for me, we're going to be looking for, well, I can turn it around here. Okay, we're going to be looking for the red reflex, and then we're going to also be looking at the optic disc and the macula and the vac, following the vessels in the eye to make sure there's no evidence of cataracts or degeneration, anything like that. Okay, very good. All right, we're also going to do a hearing test, the Weber and Ryan hearing test. So tell me, let's see if you can hear the sound, okay?
Yep. Yep.
Okay, I'm going to place it in the middle of your head. Tell me if it's louder on the right, the left, or in the middle.
Could you do it again, please? The middle?
Okay, very good. 1 second. Okay, so let's see, we'll go ahead and I'm gonna check your gag reflex here. Okay, very good. Also looking at the tonsils, grading them a +2. They're normal in size. Let's see, we'll check for JVD here in just a little bit. I'm going to assess the patient's lymph nodes. We're going to do preauricular, postauricular lymph nodes, cervical lymph nodes, submental right here, lymph nodes here, occipital lymph nodes, assessing for any swelling or tenderness. Did you have any tenderness with that? Okay. Then let's see. We're going going to move on to the respiratory assessment. I'm going to listen to you breathe a little bit. Okay, posterior. Go ahead and take a deep breath for me. In and out. Good. We want to make sure that we're listening to the full inspiration and expiration. In and out. Okay. Good. Listening for any crackles or wheezing, anything like that. Good. Okay, I'm going to come to the anterior side. I'm going to take a listen to you breathe. Good. Noting the rise and fall of the patient's chest, making sure that the chest is rising symmetrically. Let me come over here. If you lift your arm up for me. Thank you. Good. Excellent. Okay. Excellent. And one more. Good. Okay, now I'm going to go ahead and listen to the heart. We're going to listen to the aortic, pulmonic, Erb's point, tricuspid. Good. And then the mitral valve. Excellent. I'm going to flip to the bell. Do the same. And that fifth intercostal space, midclavicular line, which is the point of maximal impulse. Very good. All right. So then we're going to do tactile fremitus. So I'm going to put my hands on your chest and your back, and you'll say 99.
99.
Okay.
99.
Very good.
99.
And one more time.
99.
Okay. And then we're going to listen as you say 99 for the not bronchoscopy. All right.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Good. So we're listening for that air movement. If it's, we can hear areas of consolidation if the sound is not coming through like it should. Okay, very good. So now what I'm going to have you do is look straight at me. I'm going to hold numbers out to the side, and while you're looking at me, I want you to tell me how many fingers I'm holding up. Okay?
Mm-hmm.
Okay.
2. 2. 1. 1. 2. 3.
Okay, very good. Okay, I'm going to have you squeeze my fingers. Good. Make sure both sides are equally strong. Pull me towards you. Good. All right, hands on my hands and push me away. Good. Arms out like you're holding a pizza box. Up. Close your eyes for me. Excellent. We're looking for that beret drift. Don't see anything. Awesome. Okay, you can go ahead and put your hands down. Okay, we're going to come down here. Put your feet. Okay, press down like you're at gas pedal. Excellent. Toes up to your nose. Good. All right, knee up for me. Good. Knee up for me. We're checking to make sure that each side is equal and reactive. Bring it back against resistance. Good. Kick out like a soccer ball. Good. And back. Excellent. And then you can also do the Babinski reflex if you feel like there's a neurological deficit or something like that. Let's see. We'll go ahead and do some of the musculoskeletal range of motion since you're sitting down. Go ahead and lift your arms straight out in front of you. Excellent. Turn your hands over and back. Good. Now bring your arms out to the sides. Excellent. And bring them up. Good. Now I want you to take this hand and put it behind your back like you're gonna scratch your back. This is the Apley scratch test. Okay, go ahead and bring this arm back up and the other way. Excellent. Now I want you to take this hand and bring it back over your shoulder this way. Good. And go ahead and switch arms. So we're looking at the range of motion here. Excellent. Okay. All right. Let's see. Leg-wise, go ahead and lift up one leg. Good. And I want you to turn your ankle. Good. And then bring your knee up. Excellent. All right. Go ahead and put that foot down. Go ahead and bring the other leg up and do the same thing. Twist. Okay, so we're assessing to see if the patient has any pain, if there's any popping noises, things like that, old sports injuries that can cause issues later on. All right, I'm gonna go ahead and have you lay down for me. Just on your back. Very good. So we're gonna do the abdominal assessment. So here I would also get, check for JVD. So we're gonna go mid-clavicular. We would check here with our ruler. Okay, excellent. All right. All right, so I'm gonna be listening to the stomach, the abdomen, the 4 quadrants. I want to hear those active bowel sounds. Also noting for any distension or irregularities in the stomach. You can also listen for the aortic, the aorta. Make sure there's not a bruit. Okay. All right. So light palpation and deep palpation. Tell me if you feel any pain or tenderness. Any pain or tenderness?
No.
So you start with a light palpation, and then we're going to move to a deeper palpation, palpating for any things that may not be evident, like there could be a hernia that's not present by just observation. We're going to check for the spleen. Go ahead and, the liver, and see if we can palpate the liver on this right upper side. And then we can also try to do the right kidney, which the kidneys and the spleen are usually not palpable, but we can try at least. Spleen and kidney, you're going to just lift up, see if you can feel the kidney. Okay. Let's see. You can go ahead and sit up for me. So, also going to check. I can see your hands. We're also going to check the nails for cap refill. We want it less than or equal to 3 seconds. Feeling the temperature of the skin. Looking at the coloration of the skin. Does it match the ethnicity of the person, or do they have something going on? Like vitiligo or something like that. We'd also assess cap refill on the feet. We're going to do pulses as well. So radial pulse. Of course, you could do brachial if you wanted to, and then actually I'm gonna take your socks off real quick. And then we're gonna do our pedal pulses, our posterior. Dorsalis pedis, and then our post tube, and then cap refill on the toes as well, looking for any irregularities musculoskeletal wise. Let's see. I'm gonna have you come over here and walk for me. So I'll just have you walk forward, just 5 or 6 steps, that's fine right there and back. Excellent. You're going to assess the gait of the patient to see if they're off balance or if they're having a retrograde propulsion or they're wanting to lean back, which, you know, that could be a sign of increased, you know, encephalopathy or an increased cranial pressure or something like that. Go ahead and walk heel toe for me and put one heel in. Yes. Perfect. This is also assessing balance there. So now I'm going to have you walk on your tiptoes. Very good. And then on your way back, walk on your heels. Excellent. Okay. All right, so then you can come stand right here. We're going to do a scoliosis check. So having the patient stand, you're going to have them bend over with their arms dangling down. So you're looking at the spine to make sure that there's not any irregularities in it. That both sides of the spine, musculoskeletal system on either side, are equal. One's not higher than the other, and there's no S shape or C shape curvature to the back, other than, you know, at the cervical points where it should be a little bit, you know, more concave, and then more of a C shape here. Okay, and go ahead and stand up for me. And let's see, we're going to do our reflexes. You can go ahead and have a seat for me. All right, we're going to start with our, yes, ideally you would be up on a higher table, but this will work for now.
Sorry.
Okay, and then brachial, tricep. Okay, very good. Okay, so now I'm going to have, this is part of our neuro assessment, I'm going to have you close your eyes and tell me if something is sharp or dull, okay? So this is going to be the soft, and this is going to be the sharp, okay?
Sounds good.
All right.
Soft. Soft. Sharp. Sharp.
Okay.
Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp.
Okay, very good. All right, now I want you to close your eyes. I'm going to touch your face, your shoulders, and then your legs. You tell me if it's the same on both sides or if one sensation is more than the other, okay?
Same. 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 Same.
Good. All right, and then you can also, we're going to palpate the sinuses. Okay. Any pain?
No.
Okay. And underneath the eyes, any pain there? Okay. And then going back to the beginning with the eye assessment, you can also, you know, obviously we're looking at the eyebrows, the eyelashes, any of that. And then we can also, with the abdominal assessment, you can also check for if there's any tenderness in the kidneys if you aren't able to palpate them by just any tenderness?
No.
Tenderness? No. Okay. Alrighty. I'm gonna have you shrug your shoulders for me. Okay. Checking the spinal accessory nerve, and then I'm gonna have you smile and raise your eyebrows. Good. Close your eyes really tight. Good. Then let's see here. All right, we're gonna check hearing real fast. I'm gonna stand behind you and whisper 3 letters, numbers, combination. You tell me what I said, okay?
1, 2, 3. ABC.
Okay, very good. All right, and I do believe that is the complete assessment.